Hello, it's Dr. Buford. I'm here with Mitzi. We're just getting started on the right shoulder. We're looking from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right now we've got a cannula coming in the front of the shoulder. The camera is coming in from the back. And with this shaver instrument, we're just going to start smoothing out some of these rough areas to see exactly what needs to be done. This is the torn rotator cuff tendon that we can see from the joint side. And we'll look up here. This is where it's torn. So we're going to be reattaching it right along this part of the shoulder here. We're going to change positions with your arm before we do that. But that pretty well identifies the tear. So now we're going to look down at the biceps anchor. And so far it looks okay. Let me take that. Look right here. No, just show me the biceps anchor. I think that's going to be all right. A little bit of wear and tear changes, but nothing that's a real detachment. As we look down the front of the shoulder here, that looks pretty good. And as we look down the back, that actually looks pretty good also. Okay. Look back at the biceps anchor, please. A little bit of fraying and what looks to be the leading edge of the subscapularis tendon. For the most part, that looks okay also. You can see it's peeled off. Now we're going to go ahead and have to secure the biceps. So we'll go ahead and get that started right now. Pause, please. See the spinal needle. Let's do the tenodesis. Okay, we're just taking off the last little bit of a bone spur at the front of the shoulder, just to make sure there's nothing that's going to pinch on. All right. Okay, we'll go off on the video and show you some more in a little bit. Okay, so we're looking at this big hole in the tendon. We're going to place the spinal needle. This is the hole. This thing here, it extends from here. This is posterior, and this is way over here anterior. And so we're going to start by placing a suture anchor back here. You can see we got to get that deep layer incorporated into the repair. We're going to place our first anchor right about here. So we'll make a little nick in the skin. And then we'll take an instrument called a punch. And Kendall, come down and just rotate for a minute, just a little bit like that. Just like that, that's all we got to do. this instrument, we can first lift up, make sure we can see everything that we need to see. And then we're going to place that first anchor down right about here. Okay, so that just makes a little starter hole in the bone. And the next step is to go ahead and screw down the suture anchor. You'll see that come into the picture right there. And that's what we actually place into the hole we just made. Just like that. We'll go ahead and unload the screwdriver next. And that gives us 3 sutures to work with. You can let go. And we'll go ahead and spread these apart and decide which ones we're going to work with in what order. So we're going to go white, black, blue. So we'll reach in here and get the white one first. And then what you'll see here, on the left side of the screen, you'll see a suture hook. Here it is coming through. It's loaded with a black wire that we call a super shuttle. I'll show you that right there. Now we're going to reach in underneath here. Let's get this out of the way first. So we're going to reach in here and get this deep layer. Come back to... push down and make sure we get through all that, just like that, and remove a little bit more of these bone fragments. Okay, now we're going to go ahead and feed that wire through, and then outside your shoulder, we're going to load that with a stitch. And as we pull back, you'll see the white suture come with it. There it is coming through. Turn to the right next. Sorry. We'll pull tight. We'll look over here. Okay. And it looks like you at least want to take it that way. Is it still wrapped around? Pull tight on this. That looks pretty good. So we'll take that out of the way. Black's next. Looks like the black one's next, so we'll take this one this way. And then we'll even take the blue one out this way. Okay. And so now out of the front, on the right side of the screen, we're going to take the black and white striped one. That. And then we'll take another suture hook. This is what we call a turn to the right hook. Here's the hook coming in. Show me the end again. Okay. Coming through. We'll feed that through. Pause. Okay, so now we've got all 3 sutures from the first anchor passed. We haven't tied any of them yet, and that's because we're going to place a second screw right about here. Okay, so we'll go ahead and take a mallet, tap that down into the bone like that. There's the screw coming down. pause for a sec, please. Okay, now we're finally ready to start tying some sutures. We're going to start with the white one, I believe, which is this one here. Okay. So there's the first knot. And then we'll go ahead and finish the knot by passing what we call half hitches on top of the knot that we just tied just to secure it. Okay, let's get that. Okay, so we'll keep tying knots just like that. We'll show you some more in a little bit. On the screen is for the biceps tenodesis part of the surgery. We've already passed and tied all 6 sutures from the 2 anchors that we placed. So you've ended up with 2 metal suture anchors and a total of 6 sutures to anchor that rotator cuff back down to the bone. Things look pretty good. I'm going to show you the finished results here in just a minute once I finish tying this biceps tendon suture. One more half hitch and then we'll be done with this suture. Okay, so we'll cut the suture tails next. And so the finished result looks something like this. We've got that hole completely repaired. As I rotate, you can kind of see the sutures. And the suture line there. And there's our biceps. Okay, so we're going to finish up here. We're going to place a pain pump catheter, and then we're going to get you back to the recovery room. So good luck to you now. Bye-bye.